Next, GP practices across Nottinghamshire should be regaining access to their computers today after a nationwide cyber attack on the NHS. Returning to pen and paper, GPs have been unable to access appointment systems, medical records and test results or repeat prescriptions.
We were expecting a difficult and chaotic day on Monday morning, so we were able to call in all the staff that were working that day for an emergency meeting at 7:30. We reconstructed our appointment ledger using whiteboards. We had some standard data collection sheets printed out for clinicians to record clinical details during consultations, and those can be scanned on later. We contacted the local pharmacies to make sure that they were aware of the problem and that they could provide emergency repeat prescriptions for patients who were running out of medications, because we're not able to do that currently. Things were probably most chaotic at the beginning of the day because we were getting calls from patients who hadn't watched the news over the weekend and weren't aware of the situation. We developed a kind of key message script for our receptionist so that the patient could decide whether we could still help them on that day or whether it was better for them to postpone their appointment and come back when we're able to do what they needed. I'm hopeful that we will have our computers back by tomorrow morning, but that may or may not be the case.
Do you have the knowledge that this problem could be resolved if you had converted to a more up-to-date computer system?
It's not individual GP practice's responsibility to keep these systems up to date, and in fact we're not actually allowed to install software or update patches for fear of causing some event like this. It was interesting how difficult it was for our organisations to cascade information to GP practices. So things as simple as having a register of emergency contact details for all of the GPs or GP surgeries would have helped an awful lot in this situation. So yeah, lessons to be learned.